Wait till you see what Donald Trump and RFKJR have in store for your electronic healthcare records. My name is Scott Schneider, and this is Fed Up in Minnesota.
Medical records finally becomes a reality. This is the dream of easily transportable electronic medical records finally becomes a reality. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If I got a problem, I don't want to know about it right now. But it is amazing
You're funny,
what they're
boss.
doing.
You're so funny.
I don't know. Does
It's
it actually work?
hilarious
Can
what
they
he
do that?
steals our medical
All right.
records.
Well, then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will
Get your grubby
also
fingers in
finally
their
be able
healthcare
to
records now.
kill the clipboard. It's an expression that's used, capital,
Dickheads.
with a capital C. Kill the
You and-
clipboard.
You and Warren
Instead
Brain.
of filling out the same tedious
Yeah, you kill
paperwork
the
at every
clipboard.
medical
You-
appointment, patients will
you'll
simply
kill
be able to grant
healthcare
their
privacy.
doctors access to their records at the push of a button. Just a button,
Yeah,
and you're all
push of a
set.
button, you betcha.
All the
Push of a button.
information
You'll
the
see
doctor
everybody's
needs will be
what everybody's
immediately
up to.
transmitted. Today, the dream of easily transportable electronic.
Amanda Seitz writes this story for the AP. Washington. The Trump administration announced it is launching a new program that will allow Americans to share personal health data and medical records across health systems and apps run by private tech companies, promising that will make it easier to access health records and monitor wellness. Oh, goody. More than 60 companies, including major big tech companies like Google, Amazon, and Apple, as well as healthcare giants like United Health Group and CVS Health, have agreed to share patient data in the system. The initiative will focus on diabetes and weight management, conversational artificial intelligence that helps patients, and digital tools such as QR codes and apps that register patients for check-ins or track medications, among other things. For decades, America's healthcare networks have been overdue for a high-tech upgrade, President Donald Trump said during an event with company CEOs at the White House on Wednesday. The existing systems are often slow, costly, incompatible with one another. But with today's announcement, we take a major step toward bringing healthcare into the digital age and other things. The system, spearheaded by an administration that has already freely shared highly personal data about Americans in ways that have tested legal bounds, could put patients' desires for more convenience at their doctor's office on a collision course with their expectations that their medical information be kept private, especially with this dickhead ruling the show. There are enormous ethical and legal concerns, says Lawrence Gostin, a Georgetown University law professor who specializes in public health. Patients across America should be very worried that their medical records are going to be used in ways that harm them and their families. You better darn believe it. Officials at the Centers for Medicare and Medicaid Services, however, headed by Dr. Ozma Ben, another phony fraud in the Trump administration, who will be in charge of maintaining the system, have said patients will need to opt in for the sharing of their medical records and data, which will be kept secure. Oh, sure it will. Oh, yes, the opt-in's going to stop you. Those officials said patients will benefit from a system that lets them quickly call up their own records without the hallmark difficulties, such as requiring the use of fax machines to share documents that have prevented them from doing so in the past. We're going to have remarkable advances in how consumers can use their own records, Dr. Ahmed Oz, who leads the Centers for Medicare and Medicaid Services, unfortunately, said during the White House event. Yeah, this is after they rip away Medicaid and SNAP benefits from millions of poor Americans. They're not going to be able to use the system anyway because they're not going to be able to access any medical care. So it'll just be the rich people and us poor lazy schmucks. Popular weight loss and fitness subscription service Noob, which is signed into the initiative, will be able to pull medical records after the system's expected to launch early next year. Oh, that's just terrific. So now we have all the big healthcare companies and all their money stacking themselves against us in our privacy and medical records. Terrific. Big Daddy's watching you. And boy, does he have a long time. That might include labs or medical tests the app could use to develop an AI-driven uh, analysis of what might help users lose weight, CEO Jeff Cook told the Associated Press. Apps and information health systems will also have access to their competitors' information, too. Zoom will be able to access a person's data from Apple Health, for example. Right now, you have a lot of siloed data, Cook said, and some of that siloed data is actually a good thing, Mr. Cook. Patients who travel across the country for treatment at the Cleveland Clinic often have a hard time obtaining their medical records from various providers, said the hospital system CEO, Dr. Thomas Lev. It's Mikulyevich. He said the new system would eliminate that barrier, which sometimes delays treatment or prevents doctors from making an accurate diagnosis because they do not have a full view of a patient's medical history. Of course, if you can't pay for medical access, it won't make any difference anyway. Having seamless access to health data, such as what patients are eating or how much they are exercising, will also help doctors manage obesity and other chronic diseases, Milashevich said. These apps give us insight about what's happening with the patient's health outside of the physician's office, he said. CMS will also recommend a list of apps on Medicare.gov that are designed to help people manage chronic diseases as well as help them select healthcare providers and insurance plans. Yeah, after you've gutted the ACA, thanks a lot. Digital privacy advocates are skeptical that patients will be able to count on their data being stored securely. The federal government, however, has done little to regulate health apps or telehealth programs, said Jeffrey Chester at the Center for Digital Democracy. The Trump administration, here's Time Magazine, the Trump administration announced a new initiative on Wednesday designed to allow Americans to share their medical records across a host of apps and programs managed by private tech companies, a move that proponents say will facilitate easier access to those records across the country's fragmented healthcare system, but that digital privacy experts fear will risk making patients' data less secure. No shit, Sherlock. For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we are doing, President Donald Trump said during an initiative. Announcing the initiative on Wednesday afternoon, the administration secured commitments from more than 60 tech and healthcare companies. Blah, blah, blah. Making healthcare records easily accessible has been a goal of the federal government for decades, with the hope of allowing patients to seamlessly switch between providers, but such efforts have been long dogged by concerns about privacy and the challenges of companies offering competing proprietary records systems. Yes, and especially with this regime, that's definitely a concern. The administration's new initiative, the regime's new initiative, according to CMS, will focus on easily and seamlessly sharing information between patients and medical providers, provided they can afford one and they can have access to them, as well as increasing the availability of personalized tools so that patients have the information and resources they need to make better health decisions. Initial goals of the initiative include apps that focus on diabetes and obesity management, using conversational AI assistants to help patients, and replacing paper intake forms with digital check-in options. The announcement was the latest move by the Trump administration to emphasize the value of incorporating the latest technology in the health system. In June, Health and Human Services Secretary Wormbrain Robert F. Kennedy Jr. testified in a congressional hearing about how he sees wearables like smartwatches as a game changer in healthcare. I think that wearables are key to the Maga agenda. Make America healthy. And my vision is that every American is wearing a wearable within 4 years, Kennedy said. Yeah, the announcement prompted immediate pushback from digital privacy experts who warned of the dangers of sharing health data with companies that aren't covered by the Health Insurance Portability and Accountability Act, or HIPAA, the federal law that protects personal health information from being shared by certain entities such as medical providers and insurers without a person's consent. Andrew Crawford, a senior policy counsel at the Center for Democracy and Technology, says he has concerns about how the data will be collected and used by the companies involved in the initiative, what consumers will be told about their data privacy, and what limits there will be on how the data can be used and shared. If the company were to share a patient's information that went beyond their requested health service, like with advertisers that could potentially target that individual based on inferences from their health data, that would be problematic, Crawford says. I can think of about a million other things that would be far more problematic than that, like Donald Trump and a fascist government getting its sticky little hands on people's uh, food habits and political habits, as well as political thinking and political consumption. Another unexpected unanswered question, he says, is in what circumstances, if any, the government would be able to access patients' health data through this initiative? And if so, how they may or may not use that information. That's the question that I have just been hinting at. We've seen recently this administration, yes, this dictatorship, creating data sets that didn't exist before and using them for things like immigration enforcement, Crawford says. He points to reproductive health choices as an example of medical data that many would be uncomfortable being shared across so many companies. Yes, especially with Donald Trump targeting people through Project 2025 and their use of contraception and Plan Plan B. Many apps also collect location data, Crawford notes, so he worries about the possibility that the data collected could show, for instance, if people traveled out of state to access abortion care that isn't legal in their home state. Thank you, Crawford, for offering that up and continuing what I was just editorializing. CMS said in its announcement that the initiative would be more secure and more personalized, and use secure digital identity credentials to obtain medical records from CMS-aligned networks. Since when has this administration ever done anything that has been secure and personalized? Please tell me, other than Trump groping women. Dr. Brian Anderson, Chief Executive Officer of the Coalition for Health, well, wait a minute, the entire cabinet groping women for that matter, and a little pedophilia on the side as well, or a lot if you're in Trump's camp. Dr. Brian Anderson, Chief Executive Officer of the Coalition for Health AI. Oh, here we go. A nonprofit focused on creating guidelines for the responsible use of AI in healthcare, agrees there are some outstanding questions about the initiative, including what protections will be in place to ensure that the data shared with tech companies not covered by HIPAA will remain private. But he believes this is a challenge that can be addressed. Oh, you think so, Dr. Brian Anderson? Okay, Mr. Naive medical provider here. Oh yeah, you woke up on the bright side of the pasture land, didn't you? We just need to come together, both as private sector and public sector, and clearly define what those rules of the road are to ensure that patients' data is used only in ways that they intend and want it to be used, Anderson says. He says that he's very excited to see a group of tech companies pledging to make it easier for patients to have access to their own data, especially since our data is oftentimes not in one centralized place. Oh boy, so we're not going to sing kumbaya, kumbaya, and get everybody's health records together so the government can go take peeks at it. The people that are sucking this government dry and tearing it down and bringing fascism to the country. We're going to trust them with our health data. And good old Dr. Anderson here thinks that he's just going to be a plump chum and go right along with it. Great optimist that you are. Yes, plugging along. Just go ahead and drop down to the D and suck up the fascism. Right, Dr. Anderson? Still, others were unsure that this initiative would produce much benefit for patients, particularly if their sensitive medical records end up compromised. No shit, just like some other things might ending up compromised in this country today. I think our system is designed to promote sharing already, Crawford says. There aren't issues, and there are issues and there are hangups and flaws in that system, but I'm not sure because I haven't seen the details yet on if and how this announcement then is sharing more information with private entities, many of which will be outside HIPAA will do anything to increase the quality of care. Now, he ends up with a great point there, because obviously, I've worked in healthcare. I was a medical transcriptionist for 6 years, and I am familiar with all of the crazy insanity that is medical records and all the different types of medical systems and different care systems that are in different hospitals and different clinics. And they all clash and they all aren't in concert with each other at all, and it's difficult to combine records together and get them to other providers, etc. I've had those issues in my own personal life. But I am not going to one moment possibly think that I could entrust any of my medical records to these two frickin' dunces. Especially when you consider we have this little thing going on here called Palantir. Yep, just take a gander. There's your health information right there. Yep, that's where it's going to end up. The oligarchs doing you a favor again. Don't they always do you favors? Yeah, then now the healthcare oligarchs are going to try to do us a favor. Let's see how this one ends up. I'm figuring it's not going to be very good at all. So there you have it, folks. Once they take SNAP benefits away and Medicaid away from the poorest Americans, the rest of us unlucky suckers are going to be stuck with Donald Trump and worm-brained RFK Jr.'s electronic medical records initiative, which will not only share information with the government about all of our health and all of our wellness, so Maga can get their hands on whatever they would like to know about us, our politics, whatever we're doing, how much ice cream we're eating, whatever the heck, how much alcohol we're consuming, how much pop we're drinking, etc. Because we know Elon Musk has been had his AI systems bought up by the government, so that he can expose all the information that Doge has gathered up from all of us when they attacked all of the offices earlier this year. But don't you worry, because just like when Trump said that only the criminal immigrants will be kicked out of the country, only the worst of the worst, the rapists and the murderers and the serial killers, only those people will be kicked out. Nobody else. You took him at his word. And you know what Trump's word is worth. My name is Scott Schneider, and I am fed up in Minnesota.